In April of 2012, my husband and I are a newlywed couple. We go to see his doctor on a Friday afternoon following the wedding. We go because of something we noticed was not normal. A testicle was larger than the other, to compare in size as the size of a grapefruit. We get in to see the doctor this Friday afternoon. They urgently rush us to get in to see a specialist or radiologist to get an ultrasound done of his scrotum, in which the testicle resides in. By Sunday evening, they give us the sad news that my husband, at the age of 22, most likely has testicular cancer. For further testing and further diagnosis, we needed to see a doctor specializing in cancer, also known as an oncologist. The oncologist is a cancer doctor who referred us over to a general surgeon or a doctor who performs surgery to get a biopsy done or a sample of the tissue to rule out testicular cancer. What is testicular cancer? According to the American Cancer Society, cancer is any cell that overly rapidly produces and takes over the cell growth. Wherever the cancer starts or originates is where the cancer is going to be named by. So testicular cancer is the over rapid growth of a now cancerous cell in the male reproductive organ of the testicle. The testicle resides in the scrotum and has two functions. It reproduces the male hormones, also known as androgens, like testosterone, or also is a reproductive organ that produces sperm needed to reproduce with a female. So whenever American Cancer Society researching throughout tells us that it is a germ cell tumor and it is one of the rarest and most aggressive forms of cancer. I'd like to display to you what a testicle looks like that has cancer. The American Cancer Society also tells us there are two forms of cancer within this organ whenever it gets diagnosed. There are two types of cancer known as seminoma or non-seminoma cancer, like the form that my husband had. Non-seminoma actually grows much faster than a seminoma cancer cell. The two types, according to the MD Anderson Cancer Center, unfortunately only occurs in a 1% lifetime of a male, or approximately about 1 in 250 males. It is the most rarest form of cancer, but it is also the most aggressive, but luckily one of the most treatable cancers if detected early. So I'd like to share with you about, to relate, and that it can affect anybody, that it also affected my husband at 22 years old. I'd like to share with you about a person called Lance Armstrong. Lance Armstrong is a world-renowned cyclist who also had a very far advanced testicular cancer, stage 3. It had actually spread from his testicles to his lungs to brain and heart. Luckily, with detection, he was able to remain in remission or almost considered cured. Cancer was under control and almost gone. He got it fully treated. So the MD Anderson Cancer Center tells us that it is one that follows the young males between the age of 15 or 40. The American Cancer Society also tells us from the age between 15 and 35, overall in the young males. It is very important to know the signs and symptoms. The National Foundation of Cancer Research Institute tells us that signs and symptoms that can occur in a young male is to look out for any kind of abnormal growth, one size larger than the other, or hardness. There is very minimal pain that usually accustoms this diagnosis. If you happen to have any tenderness in the breast or in the chest as a male, it is not expected because this reproductive organ helps produce the male hormones. So if there is some breast tenderness or enlargement, there's most likely something that is occurring with this organ. Also, you want to look for any kind of hardness, discoloring, or lumps. You want to be able to check yourself every month. It's kind of like with breast cancer awareness, except in young males. You want to do a testicular self-exam. You want to examine for any kind of hard lumps, any tenderness, and this is best performed in the shower. Now, with the research and treatment, you would have to see a cancer doctor to be able to get treated for it. Treatment options is any kind of radiology or chemotherapy, also surgeries to remove the cancer, all under the care of a special doctor, also known as an oncologist or the specialist in cancer. I'd like to share this with you because it can affect any male in our family. It can be our brother, our uncle, our son, our dad. If you are within that age range, you have that risk factor of having it. If you've had a family history of testicular cancer, you are also most likely to get it. There is no way to prevent it, but if you detect it early and perform self-testicular exams, it is most likely that you're able to catch it early and find the appropriate treatment when it is needed. Also know that if a male has a history of cryptorchidism or undescended testicles, then you most likely have a higher chance of performing it. If you have any other questions or concerns, please discuss it with your primary doctor and be able to get more education on it. I would love to raise more awareness on this topic and be able to get this education out so you can share with your family and friends as well, as it is one of the most aggressive cancers, but it is also the most treatable. Thank you.